Once you've decided on a nursing diagnosis, when you make your plan of care, the nursing diagnosis will sort of determine how much the nurse is going to be involved and what exactly the patient's going to need. You're going to establish some goals that you need to determine for this particular patient. And these goals will tell how closely you're going to need to work with the patient and what kind of education will be needed. So if your nursing diagnosis is knowledge deficit in the area of a brand new diagnosis of diabetes, and you know the patient really doesn't know a whole lot about diabetes or how they check their blood sugar or how they administer their various kinds of medication, you want to establish a couple of goals for the nursing care. Maybe patient will understand the process involved with diabetes, and patient will be able to check their own blood sugar. And that kind of tells you how much exactly you're going to need to do to teach the patient about their diagnosis, to have him or her understand about blood sugar, and to teach them how to check it. And as you're figuring this whole thing out, it tells you what's going to be needed from you and your fellow nurses and what kind of education this patient is going to need. Once you've figured out a nursing diagnosis, then you make a plan to help the patient reach the goals that have been decided on. You're going to come up with patient goals that maybe help the patient learn about their medication, how to take it properly. And you want a therapeutic goal that's needing to be reached. So perhaps your initial goal, patient will be able to check his own blood sugar by, discharge date. So your therapeutic goal is to help the patient understand what they're looking for, give them parameters on what their blood sugar will be, and show them the process by which they check their blood sugar. That's going to help the nurse plan what kind of equipment is going to be needed. So think of all the things you need to take a patient's blood sugar, right? What equipment? We need a glucometer. We need cotton balls, we need test strips, we need alcohol wipes, we need batteries for the glucometer. These are all things that you, as the nurse, need to have ready and gathered for the patient as you begin to teach him or her how to check his own blood sugar. Now, when it comes to being in clinicals, and working on your care plans and working with particular patients, we see the nursing process in place. When you get your clinical patient, you're going to assess that patient. You're going to both check the patient themselves, and you're going to look at all their information in the chart. Then for your assessment or for your assignment that particular week, you're going to have to pick out what you think the main problem is with that patient. You're going to make a plan for that patient. You're going to decide on some goals. You're going to decide on the time frames for those goals. And usually we're going to have you set both a short-term goal and a long-term goal. And then the outcome criteria, which is how you know those goals are succeeding, that you have reached, the patient is going to reach those goals. So for our imaginary patient who's just been diagnosed with diabetes, maybe the goal we've decided is that the patient will be able to check their own blood sugar by the time they are discharged, which might be 2 days from now. So you'll pick a date and a time 2 days from now. And then the outcome criteria is patient will be able to give a return demonstration of a blood glucose check. And when they can do that with your minimal assistance, then you know that that goal has succeeded. Implementation tells us that what we as the nurse have to do to reach those goals. So you have to know what you have to do to reach those goals, which gives you your intervention, and you have to know why. It's important to know why you're doing a particular intervention. You should be able to report in very clear, concise language, exactly why you are doing each intervention that you're doing. And then finally, very important, is an evaluation, checking how those interventions are working. Is the patient successfully being able to reach those goals or objectives that you set at the beginning of the nursing process or the beginning of that care plan? Now, there are 4 steps when it comes to planning, and in your book on pages 4 and 5, it talks about planning and implementation. And remember, page 5, there's a safety tip that you read. It's in purple, very important. You want to determine the reason that each medication will be given. You want to learn information about the medication yourself. We don't want to give anything that we don't understand. You don't want to go in there blind. You want to understand it for your own education, and you want to be able to answer any questions that the patient and family have. You want to plan for what is needed to administer this medication. So how should this medication be stored? What technique are you going to teach the patient to administer this medication? What equipment is needed, like a glucometer for blood sugar testing, and then syringes and alcohol wipes and the insulin itself or other medications. And then you're going to develop a patient teaching plan. How is the patient best going to get the information that he or she needs about this medication and how they should take it? Now, when you are giving any medication to the patient, it's absolutely essential that you do some critical thinking. You don't want to go in there blindly and just administer a med because the physician or the other healthcare provider has ordered it. We have to be critically thinking, and this is what we spend a whole year trying to teach our students, is to always be thinking, why am I doing this? How is this going to benefit the patient? What do I need to know to make the patient understand? So you yourself have to verify the accuracy of the medication by checking the order that you have, whether it's on the computer or in a order book, against the physician's original order. When the healthcare provider comes to see the patient, he or she will write an order, and it's going to be transcribed by somebody, the charge nurse, the unit secretary. It's going to be sent to the pharmacy, and then it's going to be entered as an order that you have to follow. And if you have any, before you give any medication, you need to make sure that what the order that you have matches what the healthcare provider originally ordered. And then you want to determine whether the type of medication and the dosage are appropriate for that patient. There are 3 major things you need to do to prevent medication orders or errors. You want to clarify any order that you're not really clear about or that you cannot read. You want to check that order in your medication administration record, whether it's on the computer or paper, like an old-timey Cardex. And you're going to clarify any vague orders, anything you don't understand, with the prescribing healthcare provider.